Namaste and a very good day to all of you. Before beginning the talk, let me introduce myself. I am Dr. Udayan Das, MS Orthopaedics, Chief Consultant Orthopedic Surgeon, Sunshine Hospitals, Bhubaneswar. I have been associated with this hospital for the last 2 years and I have a 10 years of overall experience in the field of orthopedics. Before this hospital, I have been posted in various private medical colleges and private corporate hospitals. So today we are launching a campaign known as My Hospital and My Identity, in which in a very brief manner, I am going to explain you the facilities, the treatment and the care we provide to our patients, especially my subject orthopedics, which deals with diseases of bones and joints along with the surrounding tissues like the ligaments, tendons and muscles. So there are three very basic features of orthopedic treatment that we do follow over here. The first is the diagnosis, the treatment and the rehabilitation. In our hospital, we make it sure that the person is diagnosed and he is being offered the treatment that is required, which is according to the current literature. After that, we offer the patients different modes of treatment which can be surgical as well as non-surgical. And according to the patient's preference, we treat the patient and ensure that the patient is rehabilitated well. Generally, there are 5 diseases we do diagnose on a daily basis. The first is fractures or a crack in the bone as per the layman terms. Here, we either go for a surgical treatment or a non-surgical treatment in the form of plasters. Most of the treatment in fractures have gradually shifted to the surgical aspect. This is for a better rehabilitation and a quick return to work. Though in certain conditions, plaster remains the gold standard. Now coming to diseases of the bones and the joints, where the joint is destroyed. That means the joint is very painful, the range of motion is decreased in a very short span of time. In those cases, if the patient is young, we try to give them a corrective surgery, what we say osteotomy, and if the patient is old aged, we offer them joint replacement surgery. In joint replacement surgery, we basically resurface all the disease part and implant a joint replacement prosthesis for better functioning of the joint. This renders the patient painless and the patient can perform his daily activities pain-free. The third, what we encounter over here is the ligament injuries, meniscus injuries and labral injuries. Ligament injuries are those injuries where the ligament holding the two bones together are torn. Here, what we do, we don't open the joint completely, we just use very keyhole incision to perform our surgery under video or observing the screen. We can very well do all the types of ligament surgeries like we do laparoscopic surgeries for abdominal problems. Now coming to another very common aspect, a very common disease that we do encounter is bone infection, bone and joint infection, which also includes tuberculosis. In these category of patients, we first try to eradicate the infection, whatever infection is there, whatever the dead tissue is there, we try to eradicate in the first stage, and in the subsequent stages, we aim for reconstruction of the removed parts, thereby rendering the patient disease-free over a period of time. The fifth type of disorder we do encounter, not much common, but we see certain patients, is tumor conditions. And these tumor conditions may be either a benign tumor or a malignant tumor. In malignant tumor, as it is malignant, it has a tendency to spread. So what we do, we remove the part and implant a prosthesis for better functioning. And if it is benign, we don't remove the whole part, we just remove the condition whatever it is causing it, and we tend to replace it with bone grafts or artificial bone grafts. So in summary, I have explained all the 5 very common diseases, and in our hospital we always aim for a proper rehab of the patient. We just don't leave the patient that we have done our part, you do on your own. No, it's not like that. We have a very efficient team over here which takes care of the patient even after the patient is discharged. So in conclusion, our hospital, the Sunshine Hospitals Bhubaneswar, is very much equipped with all the facilities to perform all the sophisticated surgeries you have ever heard. And the infrastructure over here helps us to do the best of the care we can provide to the patients. So thank you all of you to have patiently heard my monologue, and please do pay a visit to this hospital. With all any of your bones and joint issues will be properly addressed, and help us offer you the best of the treatment possible. Thank you.